And that's the live stream started. Okay, good morning, everyone. This is the hybrid meeting for the Integration Joint Board Performance Audit and Assurance Committee. It is being live streamed, and but there is an item at the end which will be held in private, but we'll come to that issue later on. So for starters, I'm Anne Hannah and I'm chairing this meeting. Do we have any apologies?
No apologies, Chair.
Okay. Do we have any declarations of interest for any of the items on the agenda? No declarations of interest. Okay, thank you. And we'll move on then to the minute of the last meeting on the 22nd of August. I assume everyone has had a chance to read the minute. Do we agree that it's a correct minute?
Agreed.
And are there any matters arising? No matters arising. Okay, thank you all. So we'll move on now to the action log. Marie, could you run us through this, please?
So there's only one item there, and it's actually on the agenda today. So that's around the terms of reference. So it's on the agenda today, Chair. Thanks.
Thank you very much. So we'll move on to agenda item number 5, which is the IJB Strategic Risk Register. And I understand that you're going to cover that, Marie?
Yes, thanks, Chair. So this is the regular update on the IJB Strategic Risk Register. No new risks have been added to the register since the last version presented it. And I must point out that at 1.2 it says the last meeting was 27th of June, but that's not accurate. It was the 22nd of August. So just to point that out, this isn't the updates from June, it's from the last meeting. There are 9 current live risks recorded in the register. One is considered very high risk, which is the finance one, which is consistent with previous reporting. 7 are high risk and 1 is medium risk. Strategic risk 6 for commissioning has now been updated following a focused review, which was planned following the review of the strategic risk register. The recommendations in the report are to consider and comment on the high-level summary, to consider and comment on the detailed risk register at Appendix 1, note the ongoing work in relation to the changes proposed and reported to the PAC in June 2025 at Appendix 3, and note the positions set out in the action plan arising from the annual risk review presented to the PAC committee in August as well. So I'll just go through some of the details of the paper. At 4.3, so that the IJB Strategic Risk Register is routinely reviewed and updated by the Health and Social Care Partnership Senior Leadership Team and reported to PAC on a bi-monthly basis and presented to IJB biannually. A number of focus reviews and changes are underway, with Strategic Risk 6, as I mentioned, for commissioning now updated to reflect the recent work undertaken. The action plan at Appendix 3 gives an update on the other work streams ongoing, and any changes will be implemented in the overall Strategic Risk Register as they are completed and as these reviews progress. The annual Risk Management Performance Report was presented to the June committee and included an action plan to record progress. It was agreed that this would be presented to the PAC committee along with Strategic Risk Register regularly, and that action plan is included at Appendix 4 for consideration. The detailed risk register is also provided at Appendix 1. This should be read in conjunction with the risk assessment scoring matrix at Appendix 2. So some of the main changes since last reported. For Strategic Risk 1, Financial Sustainability, this has been updated in relation to the budget strategy, which has been presented to IJB in September, with a view to moving towards agreeing an updated business plan and medium-term financial plan in March 2026. For Strategic Risk 3, Partnerships, this has been updated to reflect ongoing work with locality plans and engagement that happened with partners around the Partnership Fund's investment plan, which is for 25-26 financial year. Strategic Risk 6 I've mentioned for commissioning. The previous risk information is also included at Appendix 1 for completeness to show the old version and what the new reviewed version is as well in Appendix 1. For Strategic Risk 7, Whole System Transformation, this has been updated to include an update for the Shift in the Balance of Care project. Strategic Risk 8 for Resilience and Business Continuity. It was previously reported that a workshop had been held with extended senior management team to assess the readiness of the HSCP for a major incident, and an action plan will be reported to a future extended senior management team. There's been some absence in my team, so that's prevented that from coming in October. So that's likely to go to extended senior management team in November, and will be updated in the register for the next report. Thanks very much for that. I've read out the recommendations and I'm happy to take any questions. Thank you.
Okay, thank you, Marie. I think that it will be of no surprise to anybody that financial sustainability remains a very high risk given the current financial situation of the Integration Joint Board. But it is a matter of some concern that so many of these risks are at high or medium, with only one actually being at the low level. I wonder if people could say a little more about the action that's being taken to improve this.
Thanks, Chair. So yeah, there are a number which are still sitting at high. So obviously we've got that those ongoing reviews that are happening. So we're having focused reviews and looks at a number of the risks that are held in the register. We've also got our business and governance lead coming into post on the 20th of October as well. So there'll be more focused work taking place going forward around that. And what we're actually looking at during that process is who are the leads for each risk? Do we have the right information in the risks? Are the right risks reported? So there's a number of actions that are set out in the appendix for that action plan, which will be taken forward. And I would hope that we would look at target risks as well, and review any target risks that we have for those ones that are sitting at high. Ideally, we wouldn't want anything that's very high or high. We would want target risks of high or medium for some of those. Financial sustainability, I would expect to remain at very high, though I don't see that we would be able to change that in view of the national position, the financial position for partners and for ourselves as well. So I think it's reasonable to assume that that's going to remain at very high in the meantime. Obviously, we're working towards a medium-term financial plan that's sustainable, but we still have budget gaps. So in the meantime, I think that's an absolutely reasonable assessment of the risk for finance. So I hope that helps. But there will be more work coming when the business and governance lead come into post as well, and we'll be able to focus on that better as well.
Thank you very much. Does anyone else have any questions or comments? Roger?
Yeah, the subject of cyber attacks is very topical at the moment, and it's not hard to see that it's a risk for all the areas of having gone without my computer, the whole computers up at the hospital for a day, work just came to a halt. Can you just say a bit about what we're doing to try and minimise this?
So one of the things in the Appendix 3, so we actually currently have strategic risk 4 for capacity and infrastructure. So we've recognised that that lumps a whole lot of things together at the moment. So you'll note in the action plan for strategic risk 4 that the intention is that we are separating that out into 3 new risks. So one of those being ICT and infrastructure. So we're working with Council and NHS colleagues on that, and that's one of the reviews that's progressing at the moment. So that's something we'll be focusing on and making sure that we're updating in relation to that, and whatever the latest position is. So we'll certainly be updating that, and there'll be a more focused look at that, as it'll be a separate risk completely moving forward.
Thank you very much. Councillor Flynn?
Yeah, thank you, Chair. Just a couple of quick questions. There's 2 of the risks which are currently at high and the targets are low. I just wonder if maybe that's too big an ambition to go from high to low as a target, and perhaps the target should be medium for those 2, i.e. a stepping stone. That's my first question stroke point.
Yeah, as I said, Councillor Flynn, the one we're going to be reviewing the target risks as well for each of those risks as we move forward through those reviews as well. So I would agree that if we're sitting at high, then a target, an interim target risk might be a medium to move towards that. That's so absolutely, that's something we're considering as we move through those reviews as well. And I think that's a reasonable point.
Okay. My other point really is that all the risks have shown no change, which is fine, but you've already touched on the fact that some of these risks cover quite broad categories or ranges, as it were. It'd be good to hear of some of the good news, which is probably in the report anyway, where things are improving, but it's still early days to move the risk to improvement rather than staying the same. It just looks bland, all the risks the same. It's good that none are declining, but it'd be nice to get some which I'm sure there is positive news.
Yeah, so I suppose some of those things that I reflected when I was presenting the paper, Councillor Flynn. So obviously, yeah, financial sustainability is at very high.
Yeah.
But obviously, we've presented the medium-term financial plan this year, and we've started the work on moving towards updating that medium-term financial plan and moving towards bridging that gap that we've still got. Obviously, we're moving that on, and we'll be presenting additional years with the medium-term financial plan. So that presents further challenges. But it's just to provide a bit of assurance that the Finance Oversight Group is working on that, and we'll be bringing an updated business plan and medium-term financial plan in March and having development sessions with IGB members as we move through that. Obviously, I'd always also reflected that there's ongoing work with locality plans, so we now have 2 of those locality plans in place. So that's moving forward as well in a positive way, and that engagement with partners and around the partnership funds investment plan's been highlighted as well. The commissioning one has now been reviewed completely, and although it hasn't moved the overall score, the numerical scores improved slightly around the updates in the strategic commissioning, around the commissioning risk. So we worked with our risk manager in the NHS Forth Valley and internal staff to update that risk. So there has been a slight improvement around the numerical numbers, but not the overall assessment of it.
No.
Obviously, we've got a commissioning lead-in post now as well, so there's a lot of work ongoing around commissioning, bringing together a full contracts register, working towards we've got efficiencies to make in that area as well. So although that's going to be challenging, but there's a lot of work ongoing in the commissioning area as well, bringing together the team to work towards a more focused commissioning plan. We'll be bringing forward reports to the IGB around any activity around commissioning and procurement as well. So we're looking to improve the reporting in that area as well. So we will continue to update as we bring that forward. Resilience and business continuity. So those workshops that we've held with extended senior management team to test our readiness. So they've been really worthwhile, and there's a number of actions that will come out of that. Unfortunately, as I mentioned, I've had some absence in the team, so we haven't been able to progress that. But once we do, we're moving towards a more positive position around that as well. So there are improvements. It's not all bad news. It's not saying that everything's staying the same and nothing's happening. I'm sure Gail would back me up on that. There is a lot of activity, and as we move through those risk register reviews, these updates will be provided. And as I say, each time we finalise a review, we'll update the risk register accordingly, and we'll just continue to update the current one in the meantime, so that we're reflecting any ongoing information. But as we go through those reviews, hopefully those positive messages will come through, and we'll hopefully see some improved scores as we move through, moving towards the next strategic plan as well. So that will be a significant thing for us as well to be updated in the risk register. I hope that helps.
Yes, it does. No, thank you for that. I knew that there was a lot of good work going on behind the scenes. It was just good to hear that reflected in a positive manner, because it's so easy just to look at a chart and think nothing's happening. So thank you for that, and thank you, Chair. Thanks.
Thank you, Councillor Flynn. Could I ask maybe for a wee bit more about the Shifting the Balance of Care project, because that's quite an exciting one, and I would hope that that's going to have a positive impact on the risk register, as well as having a positive impact on the people who are able to stay at home.
Yeah, so I think probably Caroline's maybe best place just to give a wee update on where we are with the project. I suppose just before she comes in, we are working towards pulling together a business plan to make the funding permanent and recurring. But I'm sure it's more around the actual, the operational aspect that you're looking for. So I'll maybe ask Caroline to come in for an update. Thanks.
Oh, we're interested in the funding too, but Caroline.
Yeah, so we continue to take forward the Shifting the Balance of Care project and look at what the data is really telling us in terms of how it's improved outcomes for individuals. So we probably need to do a bit more analysis around that. But I think the plan is that we would bring forward a deeper dive into the next meeting of this committee, so that we can be sharing some of the learning around it, as well as some of the positives in terms of the impact and outcomes, as well as the whole system impacts, which are probably a bit harder to analyse. So that's what's taking a bit of time to really look at. But I'm pretty sure that's what the plan is, that at the next meeting we're going to have a deep dive around that.
Thank you very much. The other thing I wanted maybe a wee bit more information is the next steps with the East Locality Plan, it being close to my heart, me being the councillor for the Lower Braes.
So I'm not sure who's best placed to come in with an update around that. Oh, Gail's got her hand up, sorry.
Okay, thank you, Gail.
Yeah, so that one is moving on now. So we've obviously done and completed the first two locality plans. So work is commencing on the East Locality Plan. I think in our planner, we're hoping that that'll be available towards the end of this year to come forward to IJB.
Thank you very much. There are no other. Oh, Caroline, you have your hand up again. Yes.
Yes, so we've actually completed the East Locality Plan. That's been through governance. It's the West Locality Plan that's still outstanding. So it's just for the record. But we're in the process of implementing the East Locality Plan. So I'm quite happy, perhaps, if it'd be helpful to bring an update at the next meeting around that and about how we're taking forward that work, if it'd be helpful.
I think that would be useful. I mean, having a plan is a great idea, but it's equally important that we are kept up to date with the implementation of the plan and how it's actually impacting on services. So that would be useful. Thank you, if that's possible. Any other questions or comments? No, in that case, I can find my way back to the recommendations. So we're being asked to consider and comment on the high-level summary of the Strategic Risk Register, consider and comment on the detailed IJB Strategic Risk Register Appendix 1, note the ongoing work in relation to the changes proposed and reported to PAC in June 2025 as per Appendix 3, note the position set out in the action plan arising from the annual risk review presented to the Performance Audit and Assurance Committee in August 2025. Can we agree these recommendations?
Agreed.
Thank you. We'll now move on to the next item on the agenda, which is the National Audit Report and Inspection Overview. And I think this is again your presentation, Marie.
Thanks, Chair. I'll start and I'll ask Nicola to come in around the Care Inspectorate and Mental Welfare Commission reports. So this is the usual report that gives a regular update on any national reports on the Care Inspectorate or Mental Welfare Commission reports that have arisen since the last committee. So there has been one national report around delivering the future responding to the workforce challenge. And I've set out some of the key messages starting at 4.4. So this report was to explore the challenges faced by local authorities in relation to recruiting and maintaining a skilled local government workforce and face ongoing demands, financial challenges and staff wellbeing concerns. Some of the key messages included are set out at 4.5, and these included councils facing clear and continuing financial challenges and having to make savings as they redesign and transform services. Auditors reported that councils have responded positively to challenges, but that further progress with workforce planning is still needed in light of continuing financial and demand pressures, and that staff remain the most important resource councils have to deliver services and meet the needs of their citizens. The full report link is included in the paper. And I might ask it so that I'm sure people have had a chance to read that, but I'm happy to take any questions. A number of the recommendations that were set out included making linkages between workforce strategies and corporate plans, ensuring service plans reflect corporate priorities, more clearly defined performance measures, and having regular monitoring and reporting of progress, expanding workforce information collected and better engagement with staff as part of the planning process, and transparent about how staff feedback is incorporated. As I say, that full report is included as a link in the paper. And I might ask Nicola to come in just to update on the Care Inspectorate and the Mental Welfare Commission reports that have been issued. Thanks.
Thank you. Thank you. So you can see from the report there that there's been 2 Care Inspectorate reports and 2 Mental Welfare Commission reports that have been published since the last update that's been given. So in section 4.9, you'll see the first Care Inspectorate report is in relation to Dollar Park Dementia Services. who achieved scores of 5 across the 3 key questions that they were inspected against. We do have a deep dive later on the agenda, so you'll have more information presented to you in relation to that. The next Care Inspectorate report is in relation to Thornton Gardens, and you'll see that they received scores of 5s for how do we support people's wellbeing and how is care and support planned, and a score of 4 in relation to how good is our setting. There was an area of improvement identified as well in relation to clear documentation of cleaning schedules, and there's some details there in 4.14 which highlight that the community bedded care lead has already developed an improvement plan in relation to this to meet that area for improvement, and all of the follow-up work will be progressed and monitored through the Clinical Care Governance Management Group moving forward. In relation to the Mental Welfare Commission, there was one to Trice Park at Bellsdyke Hospital, which returned 1 recommendation in relation to medication administration and having the correct legal documentation.
Can I interrupt a sec? Could I ask you to bring your microphone a bit forward?
Sorry.
I'm not sure if everybody's hearing properly.
Apologies. Is that better? Yeah. Sorry.
Very easily done.
Okay. So in relation to the Mental Welfare Commission visits, so we had one at Trice Park ward at Bellsdyke Hospital, which returned 1 recommendation in relation to the administration of medication and having the correct legal framework in place to do that. And as normal with the Bellsdyke and mental health visits, the improvement plans will be monitored through CLACS and civil governance processes. The second Mental Welfare Commission inspection is in relation to HMP Glen Oakholme. So that was visited in February and we got the published report in August this year, and that has returned 4 recommendations as detailed in section 4.17. And the plan for that is that a fuller report in relation to the action plan that's been submitted to the Mental Welfare Commission will be presented at the Clinical Care Governance Management Group in October, and details of that will be in the Management Group update that come to PAC in November, so you'll have more detail in relation to the actions that's been undertaken in relation to that, but happy to answer any questions.
Okay, thank you. Does anyone have any questions? I wonder if you could say a bit more about the workforce report. I mean, clearly there are challenges in terms of our workforce, and our workforce is absolutely key in terms of delivering good services. How are we ensuring that the issues raised there are being brought into, are being acted on? I think Gail has her hand up. Yeah.
Yes, we've obviously got a workforce plan at the moment within the partnership that we're working through, and I'll maybe ask Martin or Sarah to come in around some of the workforce retention and recruitment work that's been ongoing. Also, as we develop our new strategic plan, the workforce requirements of that will be absolutely critical. So in terms of that refresh of a workforce plan that's in place to support our future requirements. But I don't know, Martin or Sarah, if you'd want to come in and talk about some of the work that's been ongoing and the impacts of that around recruitment and retention.
I see no hands.
Oh, sorry, sorry, it's Sarah here, Chair.
Hello, Sarah.
I'm happy to come in. Yes, so we continue to have recruitment and retention challenges, such as those highlighted in the report that Marie has brought to you today. We have, as committee, you'll be aware of the fact that a couple of years ago we reviewed our pay grade structure for social workers and occupational therapists, and we created in that process a new post at a new grade, and that was advanced practitioner position, and that has proved to be popular both in retaining social workers and occupational therapists and recruiting. So that has been really helpful. We do continue to have a recruitment and retention working group which meets frequently, and it's a really well established group and an important group as we continue to measure the effectiveness of new initiatives. The Audit Scotland report talks about the importance of being really innovative around recruitment and retention challenges, and I like to think that that's what we are doing in Falkirk. So we have grow our own approaches and initiatives. We have tried using open evenings, which we've advertised and had really good support from our own staff and managers to be present at open evenings to talk to interested candidates about what Falkirk can offer them. We have used videos to be part of our appointments that we advertise, and we also ensure that we widely encourage people to consider Falkirk as a consequence of our learning and development opportunities. So we have a really, really good programme of learning and development training opportunities within Falkirk. So we're really proud of that, and that's certainly something that encourages people to consider Falkirk as a place to come to. So still a huge amount of work in this area. We still have challenges, and we look at our workforce data in various different places. So there's good governance in terms of our consideration of our workforce challenges. Hopefully that's helpful.
Thank you. Glad to hear that there's a variety of actions being taken. Let's hope that they are effective. Any other questions or comments? No. In that case, we will go back to the recommendation. Oh, sorry. Martin, sorry.
Yeah, I was just going to add that we've actually just began doing some recruitment campaigns with schools to target school leavers and tell them about some opportunities. So I'm going along to an event actually next month to meet some school leavers to talk about opportunities across health and social care. And really what we're trying to do is sell them that whole career kind of pathway that the partnership offers, and hopefully generate interest through that. Additionally, in terms of staff vacancies, you'll be aware that one of the savings was around staffing, but actually we've prioritised those difficult to recruit posts. So we really encourage managers to get those posts out to advert as quickly as possible, and we get updates around progress in relation to filling those posts. So we are proactively trying to recruit to particularly hard to fill posts. And part of that drive around getting in earlier to talk to people about careers, lifetime careers in health and social care is really aimed at generating that interest and helping us fill those posts in future. Hopefully that gives a bit additional assurance that we're doing what we can. Thanks.
Thank you for bringing that in, Martin. I think absolutely key to encourage young people to come into social care services. That's one of the big issues that we have. Roger?
Just to add to that, it's one thing to get people into posts, but if there's certain parts of services where people are leaving as quickly as they come in, and we get the assurance that where there is a very high turnover, there's some analysis of what that's about, because I think that's quite concerning in parts of the council.
I don't know if that's are you best to answer that, Sarah?
Happy to do so, Chair. So as part of the work of the recruitment and retention group, it is recruitment and retention. So we do appreciate the point that Roger makes. It's just as important for us to be retaining our well-trained and valued staff as bringing new staff into the partnership. So we look at any information that we've got, any data available in terms of understanding what's coming through from exit interviews. Encouraging the use of exit interviews is really important. So that does figure into our consideration. We don't just think about what comes through a formal exit interview, but we are interested in anecdotal as well. So the softer information that we can receive from our workforce or team managers is also considered in that space. Thanks.
Thank you very much. If there are no other questions or comments, We'll go back to the recommendations, and that is simply to consider and comment on the content of the report, which I think we can agree that we have done.
Agreed.
So moving on now to the performance monitoring report. And I think that's Callum MacDonald that's going to speak to that one.
Thank you, Chair. And good morning, members of the committee. I'm here this morning to give an update on the performance monitoring report, which started at page 50 of your packs. And of course, I'll take any questions or comments you might have after my update. This iteration of the report includes complaints and feedback information, and there's also a briefing on the local government benchmarking framework publication. There's a lot there in this iteration, so I'm not going to go through every single area in detail, but there's some bits that I would like to highlight this morning. So from our regular performance measures, performance is reported up to June 25 and with a year-on-year comparison. We have detailed exception reports for the following areas. We've got emergency department 4-hour access compliance, delayed discharges, attendance management across both NHS and council health and social care partnership services, and psychological therapies waiting times. As I said, I'm just going to pick out a few areas to highlight. So firstly, the emergency department 4-hour access compliance, the data showed a year-on-year increase in the percentage meeting the target. However, it should be noted that that has largely been the result of a change in the definitions of what should be included at national level. And without that compliance, without that change, compliance would have been very similar to the previous year's position. The other thing to just quickly add about the emergency department 4-hour compliance data was that at the last PAC meeting, we were asked about the percentage who were attending emergency department who would leave before they were seen. So I took an action to look into that, and our NHS performance colleagues have added that to the report, and we can see that 17% of attendances in June did not wait to be seen. Secondly, just to highlight from the exception reports, we've seen a year-on-year improvement on our delayed discharge figures. There was a total of 68 delays at the June 25 census, and that's compared to 80 for the June 24 census. That reduction in delays in June occurred during the initial phase of the shifting balance of care test of change. And just as a reminder, the aim of that test of change was to discharge an additional 32 individuals. That was achieved, but it's also resulted in an initial reduction in delays, and the early data indicates encouraging trajectory for delays across the summer months as well. What was previously the complaints and feedback report can be found between pages 78 and 90 of the pack, and provides information for the period April to June 25. The report details that there were 42 complaints received via the council complaints handling procedure and 112 complaints received via NHS complaints handling procedure during the reporting period. Just to note there that the NHS figure is much higher than previously, and that's because we've now included prison healthcare complaints, which were previously not included. During the reporting period, there were no complaints received via the IJB complaints handling procedure. We also had 11 people take the time to provide positive feedback to the Falkirk Council Health and Social Care Partnership Services, and the equivalent figure for NHS was 13 people providing positive feedback. At Appendix 4, which is page 99 of the pack, there's a briefing for the publication of the local government benchmarking framework, which was released earlier this year, and it covers data for the year 23-24. Most of the indicators we're familiar with, and as it looks at time periods further in the past, many of them have already been reviewed from a performance perspective. But where the framework adds value is that it allows us to look outwards and compare ourselves to both the national picture and to our peer group. A further caveat just worth considering when interpreting data from the framework is that there are indicators, for example, relating to costs. And what we can see there is the variance is so great that it suggests that we're not always comparing like for like. But to support interpretation of the publication, we've produced this briefing, which we'll share internally with managers as well. The summary focuses on how we compare with the national average, and we've produced 3 categories for the data. So there were 3 indicators in which we performed better than the national average, and that included the proportion of care services graded good or better by the Care Inspectorate. There were 2 indicators where we performed similar to the national average, and there were 6 indicators where we performed less well compared to the national average, and that included known pressure points such as delayed discharges and readmissions. So in terms of recommendations, the board is asked to consider and comment on the content of the report and to note appropriate actions continue to be taken to address issues identified. Thank you for listening, and happy to take any questions or comments you might have.
Thank you, Callum. Does anyone have any questions? I wonder if oh, sorry, I see a hand up. Councillor Flynn.
Thank you, Chair. I was just really looking at page 105, reference SW4B. I just wonder if I could ask a few questions about that, Chair. My first 2 questions really, it mentions a sample size. I just wondered, first of all, what the sample size is usually on average. And I noticed that the survey is carried out every 2 years. Is that a
That's
legal
right.
requirement, or can it be covered over a shorter period? Because it seems quite a long stretch of time to be doing surveys. So that was my first couple of questions.
No worries. Thank you. Thank you for the question. And yes, you're right to point that out about sample size. I don't have the sample size for that precise indicator in front of me, but I can get it. What we see is that there's quite a lot of variance. Some of you might be familiar with where that indicator comes from. It's the Health and Care Experience Survey. I mean, you might have had that through your door, and if you do, please do answer it. It's a national survey, and as you say, run every 2 years, and that contributes to the core suite of integration indicators that make up the part of the annual performance report as well. So it wasn't run last year, so the data is quite out of date for that indicator just now. However, it will be refreshed when we get the new data come. It'll be March now by the time we get that, which will be really interesting to see, because the last iteration of the Health and Care Experience Survey was the first one we had after COVID. And what we've seen was, a real decline in people's attitudes and experiences on the back of the COVID period. So obviously now that has moved on, it'll be really interesting to see where the data now goes. We had traditionally, before the COVID period, we had traditionally performed really well in a lot of these indicators, and as I say, we've seen a national incline. It wasn't just ourselves. We've seen that in Falkirk, but we've seen it nationally. So really keen to see how that changes. But I think it will be March before that's done. And just coming back to your question, we have no power over the frequency of that. As I said, the Scottish Government procure that survey, and as I say, yeah, every 2 years.
Okay, thank you for that, Callum. The other couple of questions really relate. It mentions talking about adults supported at home. Are these questions just addressed to the adults themselves, or do carers or family members who might have power of attorney ask, what their view is? Because it'd be easy, for the individual just to say, well, things are okay or whatever,
I think that's a really good point, and I think it's sent via letter, so it probably varies in terms of if individuals have the capacity to return the form, and it might be that it comes through the door in some instances, and there is a carer there to do that. But I'm not aware of any mechanism to proactively support carers to do that. So I think that's a really good point.
Okay. I think Gail wants to say something just now. Sorry.
Yes, Gail, could you come in now?
Yeah, I was just going to say, so the indicators that are used, as Callum set out, they do have their limitations. I think they're useful to a degree, but they do have their limitations. So it's really important that we triangulate that information with other information that we have available. And at the next PAC committee, we'll be bringing a report around the recent strategic care inspection around care at home, and they've done through their inspection quite a lot of detailed analysis around the impacts on people who receive care at home. So I think that will provide much greater detail and give us more confidence around the outcomes for people who receive care at home. So we're hoping, we had our informal feedback yesterday, so we're hoping that we'll bring that, hopefully we'll have the final report and we'll bring that to the pack for a more detailed conversation in November.
Okay, thank you. My final point or question really, and it's maybe my, I'll say, lack of understanding of percentage. How can the Scottish figure, 69.8%, be higher than any of the local authorities mentioned? I mean, how does that work? Is it just the way that these statistics are pumped through the system, you know, the computers or something?
So that's only our peer group. So the Improvement Service is the organisation that produce this data, and we've been identified in a peer group, which I think there's 8, if I remember correctly. But that doesn't include every area.
Oh, right. Okay, that makes sense. Yeah. Thank you, and thank you, Chair.
Thank you for that. Could I also ask you to look at page 103, the self-directed support situation? Now, it does look very much as if in this area we are considerably below the average situation in terms of self-directed support. Now, I do understand that self-directed support does not suit everyone, but it does look as if we may not be getting to all the people that it could suit.
Yes, I'm happy to start that. Oh, sorry. I'll just comment on the data quickly, and then other colleagues can come in if that's all right. So I think you're right. That's been a traditional area where we are a bit of an outlier. I think it's fair to say with the national data, there are challenges with the data quality, which we're constantly working with our operational colleagues to identify and support. We're looking to create some key performance indicators around this space. For example, what we want to introduce is an indicator that shows the number of service users that have had their SDS options discussed with them. And the idea is that, you know, if we monitor that closely and across the different teams and see if there's any variance, we can potentially identify teams where maybe the conversation is not happening as much, for example. So that's one of the things we're doing with the data. I do know as well. There's I think Caroline led on the introduction of a new SDS policy. I think that was that June that went to IGB. Don't know if you want to come on that.
I think Gail wants to come in on the more general position.
Yeah, I think probably Callum's covered a lot. So I think this is an area that we are focusing on at the moment in terms of recognising that we're probably not in a place that we'd want to be on. So there's quite a lot of work ongoing. The impact of that work has yet to be seen. I think that's really important. So in terms of the SDS policy coming to IJB for approval in June, that's a really key milestone. But the implementation of that, the training and development, the sort of cultural change around that is quite a large piece of work and will take some time. I don't know, Caroline, if you want to add to that.
Caroline?
Yeah, thank you, Chair. So there is a lot of work around this just to provide reassurance that we're basically relaunching SDS. So some of it's about understanding how we're practicing right now. So we have the policy, we're updating our operational procedures, looking at the training around that so that we've got a confident and competent workforce around SDS, and then have clear KPIs, just like what Callum referenced. We need to make sure that we're evidencing that we're meeting our statutory duty to offer and explain to everybody what the 4 options are, and really make sure that they're accessible, so that if people do want to look at option 1, 2 or 4, we're really supporting people so that it's person-led care as much as possible. So we're very clear around where we want to go, but it's just around implementation's taking a wee bit of time. So I don't know if there's any questions around that.
Yes, thank you. I mean, I think making sure that it's being offered and explained properly is possibly the first part of the issue, but the other is for those people who are considering it, are there sufficient levels of support in place? Because it is a big ask for people to take it on. When they do, many people find it works well for them, but it is a bit scary. Okay, if there are no further questions, oh, sorry, apologies. The hands up icons are hard to see.
Yeah,
So,
I'm just going to come in, Councillor Hannah, to acknowledge the point that you make. And, so in terms of looking at our implementation of SDS is about supporting people to decide what option is right for them. So it's not about pushing people down a particular option that wouldn't be right for them. So it's about absolutely taking that person-centred approach, recognising that different people, depending on their situation, will have different preferences, but making sure that they're aware of what options are open to them.
thank you, Gail. Caroline, do you want to come back on that one?
Yeah, thank you, Chair. It was just to provide reassurance for me. It shouldn't be scary for individuals. It's, I'm very keen to make sure that we demystify it and make sure that the right support is in place, not just for people to be able to make an informed choice, but also if they do choose to go down a route, that they've got the right support, whether it's option 1, 2, 3 or 4. And we do have examples where it's worked really well for people, like, whatever option they've chose. And what we're keen to do is to take some of the successes and really share that learning. So, people are sharing their stories around, this is how it worked for me. So that's part of what we're building. So it's that kind of clear communication as well as accessibility and improvement around practice.
Thank you. Yes, I mean, I think it does work very well for some people, and it gives them more control over their own care, which is absolutely vital. Okay, if there are no further, oh, sorry, Roger. I'm so busy trying to see the hands on the screen.
Just to reinforce what Gail's saying, I think it's really important that people are given the options, because I know some local authorities where it's pressurised on people, and I don't think that's the way we want to go in Falkirk, where people feel they have no option but to take SDS options on 1 and 2 rather than not do so and leave the local authority to take the strain and the bureaucracy.
I think that's an important point. It is all about choice and informed choice. Thank you very much. And so if no one else wants to make any comment, then we'll go back to the recommendation, which was to consider and comment on the contents of the report. Oh, I'm looking at the wrong recommendations. My apologies. I should have my little post-its in place so that I don't get lost in the paperwork. To consider and comment on the content of the performance monitoring report, to note that appropriate management actions continue to be taken to address the issues identified through these performance monitoring reports. Can we agree that we have done that?
Agreed.
Thank you very much. So moving on now to the review of social work governance and assurance across Scotland, which is a report from Sarah Lacey.
Thank you, Chair. So this report presents a summary of the Care Inspectorate's National Review of Social Work Governance and Assurance across Scotland. It was conducted between June and November 2024 and published in May 2025, and the final report is attached at Appendix 1. So the Falkirk IGB pack is asked to consider the findings and reflect on local governance arrangements, particularly in relation to equitable representation of social work, assurance mechanisms and workforce sustainability. Section 4 of the cover report outlines the background and purpose of the review. So in July last year, the Care Inspectorate advised all local authority areas of the intention to undertake a review of social work governance and assurance. The aim being to gain a national overview of approaches to insurance governance and assurance arrangements in place. That was about providing public assurance that social work duties are being appropriately discharged. The review intended to explore how staff are supported to carry out their roles and to broach concerns. The review spanned the full range of social work, so children, adults and justice social work are all included. The review intended to consider the extent to which social work leaders meaningfully influence decision making and have strategic oversight of significant risk relating to areas of legislative responsibility. The purpose of the review is laid out for your attention at section 4.3. The approach to the review noted at 4.5 outlines the various feedback points that the Care Inspectorate put in place to gather evidence. There was a national staff survey, and that focused on community-based frontline social work staff and their first-line managers, and this was shared widely in Falkirk. There was a review of core documents demonstrating local governance and assurance approaches. There were structured interviews held with a few core staff from each local authority area, including chief social work officers and chief executives. So I was interviewed, as was Kenneth Laurie, the chief executive of Falkirk Council. There were 3 themed focus groups held, and Falkirk was really well represented on all of these. At section 4.6, I'm noting that the National Review didn't evaluate the performance of individual partnerships. So we didn't receive our own individual report, but it identified what's working well nationally and areas to consider for improvement. Section 4.8 outlines the key messages from the published report, and I'll pick up just some of those for committee today. So overall, importantly, social work assurance was mostly effective. Social work leaders and managers worked effectively within complicated governance arrangements, and in most cases, these arrangements were well understood by staff, that coming through from the staff survey. Levels of oversight and assurance were enhanced by dedicated social work governance boards or their equivalent. The role of the Chief Social Work Officer was important in promoting and amplifying the voice of social work. Staff, managers and leaders felt confident to promote and uphold values within social work services. And overall, staff were supported to deliver effective services. At section 4.19 of the cover report, there's consideration of how we use this review to inform and strengthen Falkirk's governance processes for social work. So we'll assess our own structures and assurance mechanisms informed by the review findings. The reflective questions provided in the review report are going to be used for this purpose. The outcomes and improvement actions which arise from that self-evaluation exercise will identify strengths and gaps and inform future governance arrangements such as the establishment of a Falkirk Social Work Governance Board or group. The review highlighted that levels of oversight and assurance were enhanced by dedicated social work governance boards, so the Chief Social Work Officer will consider establishing this approach in Falkirk to strengthen oversight of professional social work practice. Section 5 of the cover report notes the implications of the review, notably on workforce, finance and risk. And we've talked about all of those things today at PAC. Falkirk mirrors the challenges of financial pressures, which the national report highlights. Mitigation of financial risks will be significant components of the updated IGB strategic plan, supported by a medium-term financial plan. Transformation projects are going to be seeking to ensure that services are sustainable for future service delivery, and they're really important aspects of our work going forward. We have various approaches in place to support social work services with the challenges of recruitment and retention, and our working group is constantly considering new ideas, and we offer excellent opportunities for staff to develop and learn in Falkirk via a comprehensive learning and development pathway, and I've talked about a few of their other initiatives earlier at today's meeting. Section 5.6 notes that we maintain strategic and operational risk registers which identify workforce capacity, increase in demand and financial risk. Recommendations are found at section 2 of the cover report. Thank you, Chair. I'm happy to take questions.
Thank you very much, Sarah. Could I maybe ask, first of all, that you didn't mention 410, the recognition that social work influence was at times more limited within health and social care partnerships, where it had less equal level of representation. I wonder if you could make some comment on how that applies in the Falkirk area, the Falkirk Health and Social Care Partnership.
Thank you, Chair. So we obviously from the 1st of April have now welcomed Children's and Justice Social Work into the Health and Social Care Partnership. I think that will go quite far in terms of strengthening governance of social work I think that was definitely one of the key areas that we had identified and our workforce identified when this was actually a proposal. Using the reflective questions that have been provided within the Care Inspectorate Review Report, we'll seek to thoroughly understand just the span and grip of social work governance across Falkirk. So I think the outcomes of that will help inform fully the answer to your question.
Thank you. Does anyone else have questions they want to raise or issues? And no, in that case, we'll go back to the recommendations, which are that we should note the key findings from the Care Inspectorate Review and acknowledge that a self-evaluation of local governance structures will be undertaken using the reflective questions provided in the review. And we agree that we have done that.
Agreed.
Thank you. So we will then move on to the governance statement improvement actions. And I think that's Marie again.
Yes, thank you, Chair. So this report provides the regular update on progress to implement the range of improvement actions identified through the audit of the annual governance statement and from various internal and external audit report recommendations. It's broadly under 3 categories. So the first category is around the integration scheme. So since last reported, obviously at the last report we mentioned that we'd had a number of queries back from Scottish Government around the proposed integration scheme that's been submitted. We are hoping to conclude those queries very shortly and get them back to Scottish Government, and hopefully at the next committee we'll be providing a more significant update on that. So we are concluding those queries at the moment. Around Ministerial Strategic Group self-assessment, following previous work carried out in relation to the assessment against Ministerial Strategic Group recommendations, a review of previous findings and next steps was considered at an IJB development session in June. A report was then submitted to our senior leadership team, setting out the updated assessment with only 2 items now reported as being partly established. Those related to the delegated hospital budgets and set-aside requirements must be fully implemented, and statutory partners making sure that appropriate support is given to IJB Section 95 officers. These items will continue to be monitored via this annual governance statement improvement action report, and I'll continue to report on those 2 items that are remaining. Scottish Government have confirmed that the work of the MSG and Health and Community Care has now concluded, so there is no further active monitoring and no need for us to report any further on these recommendations. They have noted that Scottish Government have advised that the recommendations should still be considered as guiding principles to ensure the success of integration, which is embedded in the work that we're doing. So there's no further need to report, so there won't be any further reports after this update coming back to PARC Committee. Other internal and external audit actions are included in Appendix 1, and updates have been provided accordingly, and I'm happy to take any questions. And the recommendation is to consider and comment on the progress report on the improvement actions. Thanks, Chair, and I'm happy to take any questions.
Thank you, Marie. Does anyone have any questions on this one? Or any comments? I wonder if you could maybe just say a wee bit more about the. I'm always quick to pick up on jargon. The appropriate support given to IJB Section 95 officers, if you could be a bit more clear about that.
So that's around the support around the financial monitoring and the financial processes. So obviously we rely on the council and NHS finance teams through the integration scheme. For me at the moment, I'm working with both partners around what those resources look like and what we need to make sure that we've got appropriate budget monitoring in place. And we're still developing that. I've got a senior accountant that was appointed not long after I started, who works with me in pulling together the financial information. And there is always a need for more resources, I think, for any support function that you're looking at. But at the moment, it's about trying to maintain that, making sure that we're developing it, and making sure that all of the leads and the heads of service have got the appropriate information that they need. So I'm taking forward a bit of a review on that, and we'll be gathering information from. We've got quite a few new leads in post. So I'll be gathering information from them on the information they're receiving from finance partners, and whether it's appropriate and whether they need any further development around that. So I'll be working with both the CFOs around making sure that that support's appropriate. So we'll just keep that under review under this report going forward.
Given the financial challenges, that is absolutely fundamental.
Yes.
So I'm glad that you're keeping on top of that. Any further questions or comments? No, in that case, we'll go back to the recommendation, which is to consider and comment on the progress report on improvement actions. We agree that we've done that.
Agreed.
Agreed. Thank you very much, everyone. So we will move on now to item 10, which is an update on Caledonia and Dollar Park dementia services, which was referred to earlier on in an earlier report, but we thought it was suggested we keep our comments to this deeper dive into that. Now, I'm not sure who's. I think Martin, are you beginning on this one?
Yes, really this report just provides an update on some of the development, the delivery and the impact of Dollar Park and Caledonia Mental Health Service. Members may recall that Caledonia used to be very much a buildings-based service, but during COVID that model shifted to be very much focused in the community. And so this report really is just going to provide an update in relation to that. And as I said, the work of JDI. I'm joined today by John McGowan, who's Senior Project Worker with the scheme, and he's going to pull out some highlights from the report. And we also have a video to share with committee, after which we'd be happy to take any questions. So I'll just hand over to John now. Thanks.
Welcome, John.
Okay, yeah, thank you very much. Good morning, everybody. Thank you, Martin. Yes, I'm John McGowan. I'm the Senior Project Worker at Caledonia Service, and I'm here presenting today in place of our team leader, Margaret Tom. So she's a very good reason for not being here today, as she's actually getting married. So
congratulations to Margaret then.
Exactly, yep. So she's passed on the responsibility to myself. So I'm here to give you a deep dive on Dollar Park Dementia Service and Caledonia Mental Health Service, exploring the development, delivery and the impact of two key community-based services to both showcase creative, person-centred approaches while responding to increased demand for flexible community-based support. So some of the key findings from the report will highlight enhanced access and capacity through extended hours and additional venues, positive outcomes for individuals and families, including improved well-being and reduced isolation, and as Martin mentioned, a shift from building-based to community integrated models, especially in the Caledonia service, which has demonstrated resilience and flexibility after the pandemic. So the committee is invited to take note of the evidence presented, which also highlights a new partnership with the integrated mental health team for older adults by introducing two 8-pillar model support workers to enhance dementia care in collaboration with Dollar Park. So the recommendations for the committee is to just simply note the progress and outcomes achieved by both services. So let's start with Caledonia Service. I'll give you a little bit of background on what's been happening there. As we've touched on, there was a major transition through the pandemic where the service moved from a building-based model to a community integrated service. The service currently offers a range of community-based groups that provide structure, routine, meaningful activity for individuals with severe and enduring mental health illness. So some of our groups solely focus on social integration, others can be new skills focused, such as cooking, meditation and conservation, and others are physical health themed, such as walking, cycling and football. Another major part of the service includes peer support, with our service users sharing their own experiences to support others. A Service user quote we received on the suggestion of the service was, "My service could be at the bottom of my garden. I don't care as long as I've got a service," which we felt underscored the value of connection over location. You can actually find more testimonials on Caledonia Service on Appendix 4 of the report. So Caledonia Service has also looked to build partnership with local organisations such as Forestry Land in Scotland, Falkirk Library and Fairer Falkirk. So with Fairer Falkirk, we work together to address digital exclusion and poverty, where we accessed their resources and provided SIM cards to vulnerable service users. Health promotion has also been prioritised through a partnership with NHS Health Improvement Services, with over half of our service users that joined in the Quit Your Way Falkirk programme successfully managing to stop smoking. Caledonia Service has also structured a referral pathway with Bellendyke Psychiatric Ward, which has improved the transitions from hospital to community care. This includes early dialogue, joint meetings, information sessions, and this all leads to more appropriate referrals, reduced induction times, and better communication between the services. And again, more information on these three partnership working collaborations can be found on Appendix 3 of the report. Okay, let's shift some of the focus now onto Dollar Park Dementia Service. I'll give you a little bit on what they've been up to. So their building has recently been redesigned to be dementia friendly, improving safety and comfort. There's also been an extension of hours with the evening and Saturday service, now offering meaningful activities and flexible respite. The service has also expanded venues by utilising Dundas Resource Centre to support up to 20 individuals each week while reducing waiting times. Some of the feedback from service users has described this as a mutual benefit for both individuals and carers. And again, more testimonials can be found on Appendix 2 of the report. So some of the more focused pieces of work the Dollar Park Dementia Service has been involved in has been a successful intergenerational work with Bantaskin Nursery. So this has involved older adults engaging in shared activities with nursery children, which has included storytelling, gardening, creative arts, and these interactions have fostered mutual understanding, which reduced isolation and promoted well-being across the generations. The initiative has been warmly received by both age groups and is seen as a model for community connection and lifelong learning. The Dementia Service has also strengthened its partnership with the Integrated Mental Health Team for older adults through the induction of 2 new 8-pillar models of community support workers. These roles are uniquely designed to enhance dementia care and are supported by both the IMHD Older Adults and Dollar Park Dementia Service. So a little bit more on the 8-pillar model. The 8-pillar model was developed by Alzheimer's Scotland, and it provides a comprehensive framework for supporting people with dementia to live well in their local communities. And the 2 new support workers that I've mentioned will work together to deliver holistic, coordinated care tailored to individual needs and circumstances, proactive support, planning to anticipate and respond to changes in health and well-being, enhanced communication and continuity between services, families and carers. And the workers will have specialist dementia knowledge to support both clinical and community-based interventions. So this was mentioned earlier on, Dollar Park Dementia Service also recently had an unannounced care inspection. So this took place on the 5th and the 6th of August this year, and it focused on their housing and support service. So the care inspectorate inspected under key questions 1, 3 and 5. And as previously mentioned, the grades received were all very good across the 3 areas. So just a little bit of background on that. So key question 1 was, how well do we support people's well-being? This was graded, as I mentioned, at 5. And the inspection found significant strengths in aspects of the care provided and how these supported positive outcomes for people. Staff understood their role in supporting people across people's access to healthcare, while recognising when people's health or well-being needs changed and acted promptly to make sure the right people were aware of any changes. People were involved in making decisions about their care and support. The service involved people under nominated representatives to review people's care and support every 6 months. And one person had mentioned all services involved in my relatives' care and support review my relatives' care together with us. And again, other service users and carer feedback on Dollar Park Dementia Service can be found on Appendix 1 and 2 of the report. So key question 2 was, how good is our staff team? The inspection found significant strength in aspects of the care provided and how these supported positive outcomes for people. Staffing arrangements were made following a process of continuous assessment. The service worked hard to ensure the right staff member was matched to the person experiencing care. As a result, people could build a trusting relationship with the staff supporting and caring for them. And one person said, "We couldn't have a better person. The staff member is just lovely and has a great relationship with my relative." And the final question was question 3, how well is our care and support planned? And this again was graded at a 5. Significant strengths were found in aspects of the care provided and how these supported positive outcomes for people. Care and support planning maximised people's capacity and ability to make choices. Personal plans were based on people's preferred outcomes and recorded how staff acted to help the person achieve these. It was clear what people's needs and preferences were, and reading personal plans gave a good sense of the person. Personal plans were reviewed on a regular basis, evaluated and updated. The leadership team had oversight of when personal plans and reviews of care had been carried out, so they could see at a glance where they needed to direct their attention. So the overall assessment for both services shows that they have responded to the increased need for flexible, localised support and demonstrated an ability to pivot and grow in response to community needs. There has been evidence gained from reviews and other feedback means that there is an improvement in mental well-being, reduced isolation and enhanced carer resilience. So finally, I'll just close with some of the resource implications. So regarding finance, there's no financial implications as a result of this report. The current budget for the service is within available spend. From a workforce point of view, there are no workforce implications as a result of this report. Regarding risks, these services contribute to reducing risk locally by providing supportive services to individuals with mental health concerns or diagnosis and their family. No legal issues have been identified in the report, and the service and report has been developed in consultation with service users, carers and community partners. And as you'll see in a minute, we also are looking to present a video which captures the views and experiences from both services. And from an equalities impact, an initial EPIA has been completed and a full EPIA is not required. The recommendations within this report do not propose to introduce a new policy or service or amend an existing policy or service. The recommendations within the report will not have an impact on people, which is relevant to the public sector equality duty. So, as I previously mentioned, we've also produced a short video that hopefully gives you a further snapshot of both services, which I'm hoping Cheryl can share with you, and I can answer any questions you might have afterwards. But before I finish, I just wanted to thank you again for your time and giving me the opportunity to talk about both services. So Cheryl, over to you, and hopefully you'll be able to share the video. Thank you.
Thank you, John. Technology permitting, we will now come on to the video.
going out with Mark because very often we go to the Biscuit Cafe at Coorous, and he's a great guy, and I've got a lot of time for Mark. He's really terrific.
New members, new people that I don't know about.
Did you enjoy it?
I do.
Good. Yeah, how do you feel about coming to the group here?
Yes, I always took this idea out. That's what I think anyway, and I enjoy it.
Yeah, I get to go where I want. Claire comes to pick me up and I'll decide where we're going. Because normally I need things at the shops and we're running about to here, there and everywhere. But it's only because I can't go out on my own. So that's a big help to me.
That's great. And what about the chill and chat group that you come to at Morrison's on a Wednesday?
It's for me, I like it because it's to do with everybody with dementia. So it's not about my husband anymore. You know, it's about me and the same type of things as me, because everything at home's all about MS and everything. So I enjoy it.
Well, you go out with Colin every Monday. Do you enjoy going out with Colin?
Yes.
What kind of things do you do?
Well, I think we try to outdo each other to see if I find something pleasant he's not seen before, or I've not seen before. We sort of try and find places.
So it's like a wee adventure.
Aye.
And a competition.
Deep breath in, hold for a moment, and let it go. And just allow any tension to melt away and gradually relax more and more deeply with each breath. Now we'll take another long, slow, deep breath in, hold for a moment, and let it go.
I am Tony, I'm a volunteer at Caledonia. I'm currently an inpatient at Trace Park. I like getting out and about and going to my different groups. A lot of the times groups aren't available and you have to sit in, and it's a disparaging sort of feeling you get from having to stay in the ward all the time. So all I have to do is get out to the group. So having the group is a really brilliant thing for me.
Thank you very much for that. And we don't often come to the Performance Audit and Assurance Committee in order to relax, but some parts of that video were very, very relaxing. So thank you very much for that. Makes a pleasant change. Does anyone have any questions or comments they want to bring forward? And I would Oh, sorry, Councillor Flynn.
Thank you, Chair. Yeah, first of all, I would like to say congratulations on an excellent report and the depth of it. I was very motivated and encouraged by the testimonials. They were all wonderful from a different section of individuals, from carers to service users to family. In fact, one caught my eye. They're all excellent, but it says the service has been like a light in the tunnel. I would be lost without it. And I think we all need to see a light at the end of the tunnel. But when you see the insight and the video, which really reinforces that, it's absolutely wonderful and incredibly motivational. I was just one question. It's just a tiny question related to the Bellside Information Services. It says that there are 27% of people waiting on the waiting list and 7% not interested. I just wonder what that number equates to, and does it mean as well the ones that are not interested don't move out, but don't become part of the waiting list or whatever, to let other people in? Thanks.
Yeah, thanks for that question. Yep, I can answer that one. Yeah, so the stats on that were dating back to October last year, and we had, when you're mentioning there the people that weren't interested, so we had 8 people that were now attending the service. There was 4 people on the waiting list. 2 individuals were carrying further input, so maybe a little bit more kind of motivation and prompting from staff for our service and from the nursing team. And there was 1 individual not interested. So we can have multiple challenges at times when we're trying to kind of sell the service, promote the service, the benefits of engaging with us. There's certain individuals, no matter how much input they want to put, we'll put in place, it's maybe just not the right time for them at that time, and they maybe need to revisit that further, or they just want to kind of solely focus on receiving their health support from the nursing team.
Thank you, John. Thanks. That explains it. Thank you. And thank you, Chair.
Thank you, Councillor Flynn. Just absolutely superb report and lovely video, and clearly a very greatly valued service. So thank you very much for all of that. One thing I would like to just ask is, given the increasing numbers of people who are living with dementia in the community, how well are the services coping in terms of the demand for the service? I mean, are there long waiting lists? Are there any difficulties for people to access the service?
As far as I'm aware, there's not any waiting lists at the moment. I have to double check that with Margaret. As I say, I'm senior project worker at Caledonia Service. But as far as I'm aware, I know the team are working through and looking to try and kind of engage people in the different services. And as I mentioned earlier, about the utilising the additional location down at Dundas has helped in that. And obviously with the evening and weekends programme. But I can double check that for you and definitely get you a fuller answer on that when Margaret returns.
Thank you. Oh, yeah, well, don't disturb her at her wedding or on her honeymoon.
Yeah.
Martin, I think you've got more to say on that one.
Yes, probably not directly, but it was just to remind members that actually when we did the review of day services, we actually realigned some money that we were saving from the closure of Oswald Avenue into the dementia service to ensure that actually they had appropriate levels of staffing and to support that weekend working. So I thought we just remind members of that. Thanks.
Thank you, Martin. Yes, I recall that. No, I'm glad to hear that there's not an unmet need out there as far as we're aware, although undoubtedly there may be many people who don't know to ask about it. So it's really good that you've done this video. Will the video be made available on the website?
Yes. We're just waiting to present today to get to share it with yourselves, and then from there, yeah, it will be going public and we'll be sharing it and using it as a promotional tool. Exactly what you're saying there is getting the word out and sharing the services are there. And yep.
Thank you. I think that's really important. Roger?
Oh, just to reassure you, Councillor Hannon, that there's a lot of unmet need out there. We can't possibly meet all of the needs of people with dementia or people with mental health problems, but we can focus on those who need it most, I think, and value the support that's offered here.
Thank you, Roger. Yes, and there's a lot of unmet need out there and probably increasing. But let's not bring ourselves down by focusing too much on that when this is actually a very good report about a very, very valuable services. Okay, if there are no further comments or questions, we'll go back to the recommendation, which was to note the progress and outcomes achieved by both services. I think we've done that, and I want to say thank you for the really useful deep dive that's been done there on the work of those services. Okay, so at that point, sorry, we did agree the recommendations, yes.
Yes.
That point we'll go on to the next item on the agenda. We're moving into the section of Integration Joint Board Assurance. So the review of performance audit and assurance committee terms of reference. We've had this on the agenda before and it's been progressing. I think, Marie, you're going to give us the update.
Yes, thanks, Chair. So this is the report. We agreed the terms of reference in January 2025 at the inception of the Performance Audit and Assurance Committee. And at that meeting, we agreed that a 6-monthly review would be carried out and a report would be brought back to the September committee. So the terms of reference has been circulated to all members for any feedback. There is one change to the terms of reference proposed at 4.15 in the appendix. So, sorry, it's attached as the appendix and the track changes are included. So at 4.15 and 4.16, this is to remove the reference to the PAC overseeing the IJB budget process. This is actually carried out by the IJB, and I think it's important that the IJB receive those regular updates and regular budget strategy reports are presented accordingly to the IJB. So we're proposing to remove that reference within the terms of reference for the PAC committee, and that's included in the Appendix 1 and shown as track changes. Section 2.3 has a highlighted area which refers to the membership of the committee, and consideration was being given to updating the number of non-voting members. However, we've now following a call for interest. It's likely that these 2 remaining vacancies will be filled moving forward, and a report will be brought around that to the IJB in due course. Therefore, no changes proposed at this time. So it's highlighted there, but just to let people know that it's likely that that's just going to remain, and that will be part of the agreement we're looking for today. And a further update at 7.3 in the appendix is included to indicate that developments for members will be incorporated into IJB development sessions, and any specific areas of development work will be arranged separately accordingly. So that's a note of the changes that we're proposing, and they're all tracked in the appendix, and I'm happy to take any questions, and members are being asked to just consider and approve the revised terms of reference included at Appendix 1. Thank you.
Thank you, Marie, and thank you for this. I think it was important that having implemented new terms of reference that there was this revisiting of it to ensure that it's working correctly and that everything was covered. And just the one change that you've referred to, just clarifying that is not because something's not being done, but because it's going to be done by the IJB, the full IJB, rather than this committee.
That's right. That's right.
Just to make that crystal clear. Does anyone else have any questions or any comments? We're now in the bit of the meeting in the bit of the agenda where it's a little drier and less interesting. So we'll go back to the recommendations. Can we agree the revised terms of reference which are included in the appendix?
Agreed.
Thank you very much. Can I just check these will be put onto the website so that they'll be available for anyone to see?
Yeah, these will be updated in the committee area. Thanks.
Thank you very much. So moving on to the next report, which is the assurance report from the Performance Audit and Assurance Committee, which is our report that will go to the Integration Joint Board. And I think, Gail, you usually have some views on what we should be having listened very carefully to the things that have been of interest to us. You're usually very good at coming forward with some ideas for what we will be highlighting to the Integration Joint Board.
Thank you, Councillor Hannah. So first question, I suppose, is for the committee to consider if they feel assured by the information that has been considered today. So I think if we could sort of seek that decision first of all, and then I'll maybe suggest some areas that I think might be helpful to be highlighted to IJB.
I think we can agree that we are assured by the detailed information we've had here today. Yes, I don't think that's a problem.
So the areas that you might want to consider highlighting for the IJB was around the paper you received on social work governance and assurance, and the key messages from the review, and in particular the view around the strength of social work governance in place in Falkirk, and the view that is becoming increasingly strengthened with the transition of children's and justice social work into the partnership. Another area that I think you might want to consider highlighting was the paper and the video you've just seen around Caledonia and Dollar Park dementia services. So that in-depth overview that you've received, including the video which captured feedback from service users and noting the progress and outcomes achieved, and also in particular the outcomes of the recent care inspector inspections, noting that all the grades across the service was very good across the 3 areas inspected. I think it's important to, while it's maybe less interested, the PAC terms of reference, the fact that has been reviewed 6 months after being agreed in line with that decision at that time, and there's a minor amendment, I think, to highlight that to IJB will be helpful in terms of their overview of the terms of reference of the PAC committee. And I'll probably suggest, possibly after the next item, which obviously will be heard in private session, there might be some things from that you might want to also highlight to IJB, but I would suggest that we consider that bit after the next report, if that's okay. But those are some suggestions at the moment.
Thank you. Does anyone have any other suggestions for items that should be highlighted? I hate to say it, but I wonder if perhaps just a general statement about the fact that the risks remain high in terms of financial sustainability, etc., might be worth adding in.
I did have that as an alternative option as well. So the strategic risk register and the detailed discussion on that, and also the question on the progress of locality plans and the fact that will come back to a future committee as well. So happy to include that as well. Generally we do 3, but we're not limited. Obviously we can include as much or as little as the committee wants.
Thank you. Any other bits that people want to mention? If not, that sounds fine to me. And at this point, we will now be moving into the question of the exclusion of the public for the final item on the agenda. We agreed that this item should be in private. And we will have a short adjournment now while the live stream is switched off, and people can go and grab their cup of tea or whatever else they need to do. We'll come back in about 5 minutes or so.